Hello Sleevers, this is Lori. I'm coming to you with my first update for my pre-op. It's October 5th and it is very hot here for October 5th. I wish it was back in the 60s and 70s. It's so comfortable. But anyway, yesterday I had my pre-op appointment with my surgeon, Dr. Salzberg. And it went well. He explained to me how the surgery would go, how long it would take, the prescriptions that I would take home, and I'll be in the hospital for 2 days. I'll go in the 16th and come out the 18th. So I have that all lined up. And then for some reason, he mentioned my gallbladder, which I'm not quite sure what context that came in, but during my pre-op ultrasound, the lab x-ray tech had told me that my gallbladder had at least 21 gallstones and that I should ask him to take it out while he was there doing the sleeve. Of course, like all good patients, I never wrote it down, never asked him, but I did tell him what the tech had said, and he kind of chuckled and he said, "What did she do? Count them?" And I said, "I don't know." So he said that he'd be able to dissolve them with some kind of medicine. I said, okay. And we went on. Well, I was checking out with the insurance woman. Her name's Linda, and she is awesome. She made all my appointments for me. She got all my insurance okay. She's great. Anyway, he popped in and said, I reviewed your ultrasound and you do have a lot of gallstones and some of them are quite big. And I would like to go ahead and take your gallbladder out at the same time I do your sleeve. Well, of course, like everybody, I like my parts. They were there for a reason. At some point in time, they're there for a reason. So I asked him if it was necessary, and he said that if there was any kind of complications after the surgery, he wouldn't know if it was my gallbladder or my sleeve, and it would make it that much easier, and so I wouldn't have any complications down the road. Now, I've never had any symptoms of having a gallstone, or stones, as the case is. So that's where I stand right now. I get my gallbladder out and the sleeve all at the same time. Also, the doctor doesn't believe in clear liquid diets prior to surgery. And I hear almost everybody having clear liquid diets before surgery, or some kind of diet. And the nutritionist said, nope. She says, we've given you already, the list of things that you need to start cutting out, so it isn't a shock to you once you come out of surgery. You should have already did kind of a transition. And I have, to an extent. I can't say I've been as good as Less of Sarah, where she sounds like she really did do a great job in doing that. I have been working out. I have cut out some things that I needed to cut out. And hopefully after the surgery, I will do well. That's all I can say. I can only do as good as I can do. So that was my appointment. I did get the bariatric advantage, some of the chewable vitamins, and they're actually pretty good. They're tasty, kind of like candy. And that's it. That's all I got. I have no pre-op appointment. My surgery is in a week and a half. I've got everything taken care of. I've got people taking me, people bringing me back. I just hope they come visit me that second day. I don't want to be alone. Anyway. Enjoying everybody's videos. Thank you for the welcomes. And I guess if I feel the need, I will do a pre-op number 2. And enjoy your weekend. Bye. Good losing.